Hello, my name is Sarah Bennett, and I wanted to explain the items that I collected for my showcase portfolio, as well as briefly discussing my story. I graduated with a Bachelor of Science degree in Genetics, Cell Biology, and Development in the winter of 2021 at the University of Minnesota. Throughout college, I really struggled with social anxiety and the transition from living with my parents in high school to living on my own in college. The balance between taking care of myself and keeping up with my academics was truly a challenge for me. About halfway through the spring semester of my sophomore year of college, the pandemic hit, and all of my classes moved to virtual. I thrived on the new structure I was able to create by moving home and setting my own study schedule. My GPA improved, and I even made the dean's list in the fall of 2020. When classes moved back to in-person in the fall of 2021, I again began to struggle with balancing life and academics. By the time I graduated, I knew my GPA did not reflect my true academic potential. At that time, I had two main passions, genetics and animals. I decided to pursue a career in the veterinary medicine field, and I became a veterinary assistant at Blue Pearl Veterinary Hospital in the surgery service. While I was working full-time with occasional on-call shifts, I began retaking some of the classes that I had done poorly in during my undergraduate years, and I drastically improved all of my grades on top of my busy schedule. I was even nominated as a fall of 2023 Outstanding Biology Student by my biology professor. I was also eager to continue learning at work. My employer has a leveling system to basically determine how advanced each employee is. Someone with minimal prior knowledge when they're hired is hired as a level 1, but you can prove your skills, take a difficult exam, and then level up to a level 2. Since I had no prior experience, I was hired as a level 1, but within 6 months, I worked as hard as I could to learn as much as I could, and I took that difficult exam and leveled up to a level 2 veterinary assistant. About 2 years after I was hired, I leveled up once again, but this time to a whole new role called an Advanced Patient Care Associate, or an APCA, which is an uncertified veterinary technician. I still work as an APCA to this day, and I have learned that it is rare for someone with as little knowledge of the field when they're hired as I did to grow as quickly as I did. At work, I also never wanted to sit around even during slow times. Soon after I was hired, I overheard one of my surgeons saying that he wished we tracked surgical site infections to basically determine if there's a common factor connecting all of our patients who get infections post-operatively. I decided I would make that happen, so I took the task on as a new project. My first report was in 2023, and I've continued to create new reports every quarter. I go through every single surgery that we perform from the beginning of the year to the very end of the year and track if there was a surgical site infection post-op. If there was an infection, then I record what bacteria grew in a culture and if the infection resolved with antibiotic treatment. At the end of each quarter, I then create reports for each surgeon, resident, technician, assistant, and any other factor that could influence infection, such as anesthesia time or if we needed to change gloves mid-surgery. I then send my manager and all of the surgeons the completed reports. This work is very tedious and it requires a lot of organization and motivation to keep up. In January of 2025, I was bit in the face by a patient at work and I was forced into medical leave for about 2 weeks. Leading up to that point, I was already questioning if the veterinary field was right for me. After the bite, I knew I didn't belong in the field. I coincidentally retook a genetics course right after my medical leave, and I fell back in love with genetics. I remembered why I was passionate, and I found myself constantly talking about what I learned with my loved ones. I joined a website called LabRoots to attend regular genetics webinars even after my class finished, and I also began virtually tutoring students again, which I did as an undergraduate, using a program called Upchieve. I felt fulfilled after helping each student understand biology, chemistry, and genetics. I believe I bring hard work, determination, and an ability to handle stress to the cohort at SCU that's created through my unique journey. I wish to support patients who are in tough situations, and I wish to advocate for them. I know that genetic counseling work can be tedious at times, and I am prepared and excited to handle that. SCU's online program will also require organization and motivation to keep up with the coursework, which I am also more than prepared to handle. I have developed coping mechanisms along the way to utilize during especially hard days, such as painting, reading, origami, and writing. I attached a few examples of my reports and some of my projects to my portfolio. That's a little bit about me, and I look forward to hearing from you all soon. Bye.